This is going to look at type 3 hypersensitivity, and type 3 hypersensitivity is considered to be immune complex mediated. So again, we are going to have a complex sort of thing where we are going to actually have complement being generated here, and as we have this, we have a rather nasty sort of immune response. There are several different types we could talk about. Hypersensitivity pneumonitis, and it is a form of pneumonia. Again, in this particular case, the individual becomes sensitized with an antigen that often comes from mold spores. Sometimes they call this thing farmer's lung, but again, it is a very unique sort of problem. We have glomerulonephritis. This occurs when immune complexes circulating in the bloodstream are deposited in the walls of the glomeruli, in the kidneys. The immune complexes damage the glomerular cells, and it leads to a really nasty type kidney problem. And there are certain types of bacteria that actually can cause this to occur. But again, it's a very unique type. It's an immune complex type. And we have rheumatoid arthritis. Rheumatoid arthritis is a very debilitating disease, and we're going to look at rheumatoid arthritis and see the way it works. And it works basically in the same manner as the other ones. Also, you have systemic lupus, which is, again, another very debilitating disease, and it comes out of a type 3 immune complex mediated type problem. We go back to the mast cells. Remember the granulocytes of the immune system, and these have inflammatory chemicals inside of the little granules. In this complex, we get degranulation of these inflammatory chemicals, which causes inflammation. It can cause destruction and everything. And as it does that, you get breakdown of material, and you get disease coming from that. Here's your mechanism. The immune complex mediated type hypersensitivity. It says antigens combine with antibodies to form antigen-antibody complexes. The antibodies in this particular case are IgG. Phagocytes remove most of the complexes, which is the way phagocytes work, but that some of them lodge in the walls of the blood vessels. As they lodge in the walls of the blood vessels, complement comes along, and complement comes in contact with this, and complement holds onto it and becomes activated. The activated complement is then going to come in contact with neutrophils, which are going to degranulate. And when they degranulate, you get all the inflammatory chemicals coming out right in there, and it causes destruction of the capillary walls or the blood vessel walls, and all of a sudden we have got a major sort of problem in there. All of these work in the same way. Think about pneumonitis. This is in the lung tissue. In the lung tissue, what is lung tissue? It's a very delicate balance of thin-walled cells and capillaries. Nephritis in the nephrons. Again, the kidney is a very delicate balance of thin-walled cells and capillaries. So if these get in there and these start doing things in the capillaries, either in the lungs or in the kidneys, you've got a problem. That's what we're looking at with these, is with respect to kidneys and lungs. If you look at rheumatoid arthritis, this is essentially a very cruel sort of immune problem. When we think of rheumatoid arthritis, we normally think of people who are older in age. I mean, you look at this hand, it looks painful just to see it like that, the way it is really twisted. And again, we go back to the concept of the mast cells, which are often present in the joints. So in this particular case, you get an individual who degranulizes mast cells in the joints, and that is going to cause irritation in the joints, and it's going to cause destruction of tissue. And as it causes destruction of tissue, the tissue is not going to be able to regrow the way it normally would. And you get twisting of the tissue and damage to the tissue like that. If you look at this is an x-ray of someone who has rheumatoid arthritis. Normally we would anticipate a joint to look more like this, even though you can see that there's a lot of spongy type bone over here that's not supposed to be quite like that. But if you look at this particular joint, what you see is this is not symmetric like this one is here. What you see is this one has actually become twisted, and as it becomes twisted, it's not going to sit in the proper manner. Over here, we're going to pop in what a normal joint would look like, and you can see this joint here is fairly similar to the normal joint up over here, but these joints over here do not look like normal joints. And as such, even up here on the end of the finger, you can see that the joint does not look proper. And that is what leads to the problem we call rheumatoid arthritis. And it's a very debilitating sort of problem. This shows you lupus. You get the same thing occurring on the cheeks, where you get destruction of the capillaries underneath of it. It is an immune problem. In this particular case, it shows up on places like the face and other places on the skin. But imagine all the complexes and problems it's doing on a much lower level. When we deal with these are very severe type autoimmune disorders.